Well, thanks everyone for coming. I want to thank all the journalists who came out today. I realize it's hot. You have a lot of things to do. So I appreciate you making time. Before I get started, I also want to say thank you to my staff, including my campaign manager, my deputy campaign manager, my campaign writers, my policy director, and the rest of my staff who have been working very hard throughout this campaign. I also want to thank my running mate, Karina Brown. I'm going to give a few remarks, and then Karina is going to join me and also give a few remarks. And then I especially want to thank Dr. Brian Poole, who is looks like we're having a little trouble with the, well, especially thank Dr. Brian Poole, who is a microbiologist from Brigham Young University, from BYU, that specializes in virology. Brian has been kind enough to be advising our campaign on some of the developments with the coronavirus. So thank you all. Well, the reason we're here, the reason that we're here in this location is because of something that happened in 1983. In 1983, we had in this state a record snowfall, an enormous snowpack that filled up our mountains and led to a historic flood that year. And I remember when I was a little boy, my father took me down to this spot right downtown where I saw from, up close, from the perspective of a little child, what was to me a remarkable development. So much snow was melting from our mountains, raging down City Creek Canyon, that the runoff threatened to flood some of our most important cultural landmarks and the downtown business district, which is critical to the overall economic health of our state, and also many of the most important cultural institutions that Utahns care about. I was stunned as a child to see Utahns come together from all walks of life and volunteers build with sandbags a river right where we're standing down State Street to channel an enormous torrent of water into a makeshift river. And what we used to do that was actually very simple technology. We used sandbags. We had some loaders, and what we also used was a community spirit where we came together to solve a problem that was facing our state. It was a natural disaster, but we overcame it with teamwork, cooperation, and a community spirit. Well, today, I believe that Utah is facing another natural disaster. One of the challenges with this natural disaster, though, is that unlike water in a flood, people can't see the virus that's spreading through our neighborhoods. It's invisible. And that makes it harder to understand and a little bit harder to control. But just like a time-tested strategy of controlling a torrent of water with sandbags is relatively simple, we also have some important tools that can help us stop the torrent of the spread of the coronavirus pandemic that's now threatening to engulf many, many of our neighborhoods. We have to recognize what's happening for what it is. It is a natural disaster, and we need to take steps as a community to come together to solve that natural disaster. Sadly, however, I believe that so far the Utah state government's coronavirus response has been inadequate and not up to the job of addressing this natural disaster. The worst part of this pandemic, both in terms of public health and economic hardship, is still ahead of us. If our public servants do not lead, we are risking an economic and a health catastrophe. So today, I am announcing a call on Governor Herbert and Lieutenant Governor Cox, the director of our coronavirus task force in the state, to make 5 major changes to the way that the coronavirus task force is guiding our state out of this natural disaster. So first, we need to adopt a state mask mandate for public spaces. Utah should adopt a temporary mask mandate within indoor and outdoor public spaces where social distancing is not possible. The Federal Center for Disease Control currently recommends that people should wear face coverings in public settings and when around people outside their household when other social distancing measures are difficult to maintain. Face masks are now proven effective at helping to limit the spread of this dangerous disease. That's why more than 20 states across the states, including many of our neighboring states and many states which have real cultural and economic similarities to the state of Utah, have adopted temporary emergency statewide mask mandates. Also, it's not just states here in the United States, but countries around the world, including many of our major trading partners and many of the countries that have been most successful at limiting the spread of the disease, have also adopted mask mandates. Those countries include France, Germany, Italy, Japan, Spain, South Korea, and most recently the United Kingdom. So that's point one. That being said, we also need to have some exemptions and some reasonable limits to the statewide mask mandate. It should be temporary. That's the first and foremost. Second, we need to have an exemption for babies and toddlers that can't wear masks effectively. Third, we need to have an exemption for medical conditions, including people who may have mental health challenges or respiratory challenges that make wearing a mask unfeasible. Fourth, we need an exemption for hearing impaired or people who are communicating with the hearing impaired that rely on lip reading in order to communicate. Fifth, we may need a workplace safety exemption for people that may be around dangerous machinery for which a mask might not be feasible. Sixth, we need to have an exemption where people are using a service that requires uncovering the nose or the mouth. So if you go to the dentist, for example, we can have an exemption for that. And we also should have an exemption for people who are seated within restaurants and are eating. That obviously makes sense. We may need that as well. And we also need an exemption for, we may need an exemption for jails or prisons and the Department of Corrections to make sure that the mask mandate is working well for them. So there are many other potential exemptions or exceptions that we might need to consider. And of course, we leave that to the sound discretion of the existing state government to control the best way to go about implementing this type of temporary emergency mask mandate. The second overall call for change in our response is to develop and implement an emergency plan for producing, ordering, and stockpiling N95 respirator masks for frontline workers. There's growing scientific evidence that the coronavirus can now stay afloat for hours and spreads through airborne transmission, particularly indoors. Frontline workers who are in close contact with the public while inside need to have the best available protection in order to avoid spreading infections. N95 masks, which are old technology, are widely available before the pandemic and are relatively inexpensive to produce, provide filtering of up to 95% of very smart particles, including viruses and bacteria. That's why many physicians and nurses and other hospital workers rely on N95 masks to keep them safe. Sadly, however, as we are nearly a half of a year into this viral pandemic, we still have a shortage in Utah of the critical N95 masks that are most likely to keep our frontline workers safe. The state of Utah needs to take charge and address this shortage, both for state workers, including our public school teachers, and also assist private business in making sure they have a supply of N95 masks available for their staff and employees who are in harm's way. Third proposal. We need to develop and implement an emergency plan to provide adequate coronavirus testing. Currently, according to the Harvard Global Health Institute, we rank 37th in the country in testing progress. Because asymptomatic people who are not exhibiting symptoms of the virus, can transmit the virus without knowing that they're doing it, we must be able to identify people who have the virus to prevent them from spreading it to their coworkers, schoolmates, and loved ones. Without a systematic and adequate coronavirus testing system, we will not be able to successfully suppress the transmission of this virus and keep as many Utahns alive and healthy as possible. Also, a systematic and effective coronavirus testing system is absolutely crucial to ensuring that people can do business in the state of Utah. Our businesses will not recover until people feel safe enough again to go out and resume their lives and do business with the great entrepreneurial free market spirit that all Utahns believe in. We need masks because they are good for business. We also need testing because testing is critical to getting our businesses up and running. Fourth, we have to develop a plan and implement that plan to provide the resources necessary to safely reopen Utah's public schools before next month. Without a plan to keep our kids, teachers, and school staff safe, schools could turn into a COVID-19 super spreader site. Utah is not currently on track to provide a safe environment for students, teachers, and staff in our public school system next month. Currently, Utahns do not know if our kids and teachers will be safe when they return to school next month, and the Coronavirus Task Force has not provided the adequate testing, tracing, and personal protective equipment to keep our families safe. The acceptable number of student deaths in our state is 0. The acceptable number of teacher deaths in this state is 0. The acceptable number of staff deaths in this state is 0. Finally, fifth, we need to develop and implement a plan to provide contact tracing to suppress the spread of the coronavirus. Utah does not currently have a sufficient contact tracing plan in place. The existing plan relied on a $6 million no-bid contract to political insiders who were not prepared to actually provide sufficient contact tracing software. That web application has now failed. Instead, there is currently better software that's available free of charge on a volunteer basis that's been available and utilizes Apple and Google's additions to their software operating platforms and are designed to protect the privacy of individual users while also avoiding false reports. The state needs to adopt sufficient contact tracing technology, and we need to ramp up tracers, personal human tracers, to give the Department of Health the resources it needs to track down the spread of the virus and safely, respectfully quarantine people who are ill so they do not continue to spread the disease. Well, those are the actions that we're calling on the state to adopt. But I also want to speak to my fellow Utahns right now. And I want to reach out to them and let them know that I understand right now we are having difficulty finding trust, compassion, and community in our state right now. But I want you to know that I believe in Utah, and I believe that in a natural disaster like this, we can come together and use teamwork, cooperation, and basic human decency to adopt the best available, simple, and time-tested technologies to get us through this crisis. This is not an example of tyranny. This is not an example of something that's unconstitutional. The people who are claiming that don't have legal authority that they can cite to make that claim. But respectfully, this needs to happen now. It's going to be too late for our kids to go back to school safely if we do not bring this viral outbreak under control. So thank you all for listening. Thank you, Utah. Let's be decent and kind to one another, and let's get ourselves through this situation as quickly and as safely as we can. Thank you all for coming. Now I'm going to turn it over to my Lieutenant Governor running mate, Karina Brown. Following Karina Brown, Dr. Poole will speak, and then we'll take questions. Thank you. Thanks.
Thank you, members of the media, for being here today, and thank you, Chris, for your remarks. Although some parts of rural Utah have not seen high infection rates, if we wait until the virus is spreading in our communities, it will be difficult to limit harm to others, especially seniors. Several more rural communities, including San Juan County and Hiram in Cache County, where I live, have had the worst outbreaks. Wearing a mask is a form of community service to others. The aggressive preventive efforts we make now to limit the spread of the virus will mean a safer educational environment for Utah children and teachers and a safer business work environment. Utahns have come together in the past to overcome difficult challenges, and now is the time to unite in our effort to stop the spread of the coronavirus. Thank you.
Hi, I am Dr. Poole. I'm Dr. Poole. I am a professor of microbiology and molecular biology at BYU. The things I'm saying shouldn't be considered official BYU policy. I'm speaking for myself. But I do have 20 years of experience working with viruses, so hopefully I have something useful to say. I'm really glad that Professor Peterson started off talking about the community effort where everybody came together to build this river. I also remember coming up here when that was happening and seeing the people kayaking down the middle of the flow and just being so impressed with how everybody joined in. Masks are like that. Masks do not usually protect yourself very well. Masks are not designed to protect yourself very well, at least this type of mask. What masks do is they protect you from hurting somebody else. And so this is not a situation with this virus where we can say, you know, this is all about me, or I'm going to just take care of my health and let everybody else take care of their health, because we all depend on each other's health. If we have 50 people who are being responsible and wearing a mask in a room, and one person comes in without one, that one person can then undo the work of all of those other 50. It's not just ourselves that we need to worry about, it's everybody else too. So there's a couple of things that I've really been worried about and that I've heard people say about this virus. The first one is that the virus has a very, very low death rate, and that's the only thing we need to worry about. And while it's true that the virus does kill mostly older people, it kills a lot of older people. So people can say, oh, it only has a 0.5% death rate. But if you're over 80, then you have a 20% chance of dying if you catch this virus. That's 1 in 5. And I'm not willing to risk a 1 in 5 chance of my loved ones who are a little bit older dying. I mean, it's a very serious infection. It's even, as you go up the age ranges, it gets, more and more deadly. But I don't think that even death should be the only standard for how we consider this virus. We've learned so much more about it since it first started. We know now that it affects the circulatory system, it can affect any system in the body, and even if you're 20, if you're between 20 and 45 and you get the coronavirus, you have about a 10% chance, 1 in 10, of going to the hospital. Okay? This is a serious infection. We do not want our 25-year-olds going to the hospital, 1 in 10. I'm 45. 45 to 65-year-olds have a 20% chance of going to the hospital if they get infected. And the consequences of this virus, we don't even know how long they can last, but we do know that many people have them for months and months. They have respiratory problems, they have circulatory problems, they have kidney problems, things like that. So this virus is much more serious than, a small death toll. Also with the masks, I said that masks aren't super protective at protecting yourself, but they are very, very effective at protecting other people. I've heard people say that, viruses are so small they can go right through the masks. Viruses are very small, and by themselves, maybe they could, but the coronavirus is kind of a wimpy virus. It can exist outside of a little droplet of water. And these masks are more than adequate to catch those little droplets of water. And so if you're talking to somebody, you're spewing your water droplets right in their face. If you wear the mask, it's catching all of those and maybe redirecting a little bit of it up or down. You're limiting your spread. You're protecting everybody around you. One of the things we learned about the virus, Professor Peterson mentioned, is that it can stay in the air for a long time, longer than we thought. And so if you're in a classroom and one person isn't wearing a mask, then that person's droplets will probably wander through the entire classroom, and everybody there has a chance of being infected. So masks are incredibly important. They are not dangerous. You can breathe just fine through this. I used to work in a factory, and when I worked in the factory, I had substantially heavier masks than this one and never had any problem. Masks, a lot of people are kind of invested in masks being dangerous, but they're really not, like not at all. And so those are just, and they're very simple. These are just very simple things we can do to try to curtail the spread of the virus, to protect everybody around us, and to make our society ready to open back up again. I know of schools who tried to do summer school. 3 days in, somebody tested positive with the virus. They were closed down for another 2 weeks. We need to stop that from happening. We need to stop the spread. We need to do it right now. The best way to do that is to follow the recommendations that Professor Peterson laid out. They're going to be very helpful in curtailing the spread of this virus, and then hopefully we can get, to teachers the types of masks that actually are very protective, that do keep you from getting sick, so that we can have 0 dead teachers and 0 dead kids. Thank you.
Well, that's all we have for a presentation. If you have some questions, we're happy to take a few questions. Go ahead. No, there are 5 differences between our plan and what the state is currently doing. Excuse me. With respect to face masks, we're proposing that the state immediately follow along in the wake of 20 other states, including Kansas, California, several other states, and mandating a statewide mask in public spaces. A statewide mask mandate in public spaces where people are not able to socially distance. That's not the current policy. We're recommending that they go significantly further than that in order to keep people safe. And in addition, in the press release, we also identified 4 other challenges with our current policy that need to be addressed. No, they're not. What we're calling for is they have to get it done. We don't have widespread N95 masks available for frontline workers. They've got to accomplish that. They're the folks that have the resources. Their job is to protect us and make sure we have what we need to get the job done. We picked this spot because this is where the river that was built that went down State Street at a time of one of our recent natural disasters in this state. Back in 1983, Governor Scott Matheson recognized that the central business district, which lies just behind us, and some of our most important cultural relics and resources were threatened by an impending natural disaster. We can put out some pictures of it if it's helpful online following the event. But just right there is where City Creek Canyon came out, and that's where they built a river going straight down this street where you are standing. So I brought us here to this spot because I'm trying to get everyone to come together and recognize that when we have a natural disaster, we have to pull together and use the technology and the resources that we have at hand. Back in 1983, Governor Matheson realized that sandbags and some earth-moving equipment and many, many volunteers pitching in together would be able to divert the flow of the flood away from the downtown business district and our important cultural institutions. And with teamwork and volunteers, we averted a catastrophe for downtown Salt Lake City. That's what we need right now. We need to use simple, time-tested technology that everybody is familiar with, community spirit, to stem back the torrent of a dangerous viral epidemic that is spreading through our neighborhoods all across the state. The only difference between these two natural disasters is that it's easy to see the water and the virus is invisible. We came to this spot because I'm trying to get people to remember that in our past, in better times, when we were more bipartisan and more cooperative, when Governor Matheson was in charge, we had community spirit and leadership that averted a catastrophe from a natural disaster. That's what we need today. I'm cheering for Governor Herbert and I'm cheering for Lieutenant Governor Cox. They are good men. I respect those guys. They're doing the best that they can. But we're here today because they need to step it up. They're not getting the job done. They need to protect our teachers, kids, and staff in our schools. They need to protect our businesses, which are threatened. Many small businesses and some large businesses are teetering on the edge. We will not address this economic and public health crisis until we start using the most basic and simple tools and community leadership and public service to overcome this natural disaster. So the question is from Lisa Riley Roche at the Deseret News. The question is, in essence, how would we propose enforcing the mandatory mask mandate? My answer is reasonably. I think that we need reasonable actions. We need to have compassion. There may be some warnings that need to be given. If there are persistent offenders who refuse to cooperate, maybe it's appropriate for them to get the equivalent of a parking ticket. We do not want tyranny. We are a liberty-loving state. And I'm a liberty-loving and a freedom-loving guy. I leave the details of enforcement to the team that the governor has assembled. I'm confident that Governor Herbert and Lieutenant Governor Cox, with their team, can assemble a reasonable path to enforcing a mask mandate. Our key point today is that we need to go forward and actually implement that mandate immediately. So the question is whether or not we disagree with plans to reopen the current plans to reopen the schools in the fall. Well, first off, I do take exception to the way that you're characterizing when schools are scheduled to reopen. It's not the fall, it's 1 month away from now. It's in August. Schools are supposed to open in a month. And my concern is that having reviewed those plans, having shared those plans with my various advisors and experts, I do not believe that they are currently adequate to keep kids, teachers, and staff safe. So what we are calling on is the governor and lieutenant governor and the coronavirus task force, together with the State Board of Education, local community schools, and in partnership with representatives of the teachers of our state, to come together and form a better plan that will actually get the job done. I appreciate the work that's already gone into this. I know folks are trying hard, and I'm grateful. The problem is we're not getting the job done, and the stakes are too high. We've got to keep the kids and the teachers safe. Okay, any last questions? Well, in last remark then, please bear in mind, we've got to come together, we've got to cooperate with one another to defeat this natural disaster that's threatening Utahns. I'm very grateful for the press, for their coverage. I'm very grateful for you coming down. Let's all do this together. Thanks, everyone.
Put on your mask.
All right.